Hi there, I'm Dr. Kelly from the Pennsylvania Pain and Spine Institute. I am the president of our facility and institution, and I'm happy to have you here today for our webinar on healthy aging and spinal mobility for our Senior Talk series. So thanks for coming. And I just wanted to put out there that we will be open for questions at any point throughout the presentation. So please feel free to type those up and send those through for us. I did my training at Harvard Medical School in the Department of Physical Medicine and Rehabilitation. And I'm what's known as a physiatrist, which is kind of a combination between an orthopod, a neurologist, and a rheumatologist. And it's sort of a unique hybrid specialty that we are quite proud of because there's not very many of us in this specialty that do what we do in pain management. Some unique features to our practice, which I wanted to elaborate on in transition to our Senior Talk, is that our center is completely independent of any surgical affiliation. So we tend to promote at our practice when it comes to pain management and dealing with painful spinal conditions, especially the lack or non-use of surgical or major surgical modalities. We find that over years of identifying surgical procedures and evidence-based medicine on surgical outcomes, that surgeries, especially in the aging spine, can have very limited functional and beneficial outcomes. So our practice is geared very much towards minimally invasive options, new and cutting-edge novel approaches to treating spines, especially in the aging spine. So I wanted to offer that bit of advice out there, and that makes us quite unique in the sense that we are an independent-based pain management practice. Our overall goal when we think about the aging spine is really to promote mobility. And the single best exercise and activity that we have, and I'm constantly asked this by the patients about which gym I should join or what facility, should it be Planet Fitness or the YMCA? And I often mention the best gym out there and the best membership that you have is actually free. And it's open 24 hours a day, and it's outside, and it's walking. And that is the single best exercise method that we can do to promote the healthy and aging spine. Now, the conundrum is, what if we're in pain, which limits us and prevents us from walking? Well, that's where we come in. That's where you need a specialist that is offering minimally invasive, non-surgical methods to help eliminate pain, thereby allowing you to be able to walk much better, more fluidly, with better balance, and in less pain. Some of the options that we offer are both new and old, and I'm quite proud to mention that we are the only pain management facility in the area that now offers acupuncture. And that would be on the older spectrum of treatment options. Medicare now fully 100% reimburses for lumbar acupuncture treatment. I often tell patients that if they can mention a treatment strategy or a treatment plan that's been around for over 2,000 years, go ahead and tell me, because it hasn't been around, but acupuncture has. It's been proven. It's been quite effective. And we offer that for elderly patients, Medicare recipients, some commercial insurances, not all, but some. And that can be an excellent modality, not only to help with pain, but mobility of the spine, especially the aging spine. Now, on the newer spectrum, we have some advanced procedures, some of which we've had some previous webinars elaborate on. And one of those procedures that we're quite proud of that we offer is called MILD. And that's an acronym, MILD, which stands for minimally invasive lumbar decompression. And this is a little bit more of a procedural-based treatment that involves basically a major non-open surgical approach to alleviating a major issue that all of the aging spine will encounter over time. And that condition is called lumbar spinal stenosis. Now, as we look at lumbar spinal stenosis, one of the more conservative and complementary treatments that we have is acupuncture. So we can start at something very gentle and mild and work our way up to something a little bit more advanced, which is that mild procedure that I mentioned, all with the goals of promoting mobility and especially walking, because walking is the key. I like to read a lot of data on longevity, and I think there's a lot of new and cutting edge biocellular level based ability that we can incorporate into living longer. And it can get very technical and very fancy. But when I read all these articles and I gather the most important information, I take home two things. The key to longevity is 1, mobility and walking. 2, a positive attitude or outlook. So being optimistic. So mobility and optimism are the key to longevity. It's pretty basic. We probably, you don't need to be a physician or a scientist or a longevity expert to know that. But I think what a lot of people lose hope in and find sort of a roadblock in with their care, their medical care, is really addressing the issue of mobility with their physicians. So I do want to let you know that we really are in tune with our patients in addressing that issue, really trying to figure out how mobility impacts your life and how we can make it better with minimally invasive methods and more traditional or conservative things like acupuncture. With that said, we offer a lot of expertise now in nutritional and supplements that can be beneficial to the aging spine and mobility. For instance, a lot of our dietary methods and our diets can impact inflammation in our bodies that we are not aware of. A prime example is, the use of Tylenol. Tylenol over time, as we know, when used even in small doses, can inhibit our natural ability to produce a chemical called glutathione. And glutathione is a wonderful antioxidant that is used in our bodies as a direct anti-inflammatory. So looking at how that impacts your pain and your mobility is something that we are very keen with and adept at doing here at our office as far as adjusting medications and adding supplements. So I think some key take-home points, and I wanted to open the session up to questions, are that with the aging spine, you're not alone. We will all encounter back pain at some points in our lives. It's very natural and very normal. The one condition that we want to recognize and educate further on is this condition called lumbar spinal stenosis. It's a very common spinal issue that we will all develop. It's compounded and made worse by lack of mobility because it can be a very painful condition. Some of the attributes to it are that we preferentially like to sit more when we have lumbar stenosis, and that when we stand or we walk, we tend to have more pain. We like to break that cycle. We like to make pain less of a factor in the stenosis process and get people mobile and walking more, especially as they age. So I think that those are some major take-home points as far as the senior back, mobility, and aging, and how we can sort of address some of the issues in broad terms. And I'd like to see if you have any questions for me or would like to offer some input or maybe some treatments that you had some questions about.
One question, what can we do to treat aging arthritis?
So arthritis is an inflammatory process in the body, typically associated with aging, but not always. And it depends on where the arthritis is coming from. So I'll give you a classic example of knee arthritis. We tend to all develop knee arthritis as we age. Well, one thing that can be offered is looking at your course of your diet, looking at the course of your medications that you're taking, because as I mentioned, one common issue that a lot of people miss is the effect of natural antioxidants in our body that are being depleted from our diets and medications that we're taking. And simply addressing that can actually help with arthritis pain and improve our own natural antioxidants. There are some new offerings in the world of arthritis other than anti-inflammatory medications. For instance, there is a newer product that can help with the arthritis or inflammatory process that we use in the knee. It's a very long-acting and targeted cortisone product that time releases over months. So for instance, if someone were to have knee arthritis and they've had a traditional cortisone injection, we hear often that patients will get relief anywhere from 2 days to 2 weeks, maybe 2 months if they're lucky. So there's newer products out there that actually encapsulate or encircle or put the molecule, the cortisone molecule, in a time release fashion so that you're getting benefits of the cortisone being released over 8, 9 months, maybe even a year. So as far as newer and cutting edge products, that's an offering, as well as looking at the diet, the inflammatory markers in your body, and some of the medications, which can all help cut back on the arthritis process.
Next question, what is the best way to slow progression or prevent the aging back?
I think, the number one area that I mentioned is walking. And I think the mobility comes with obviously walking. If we're in a bind where we're starting to experience more pain, we're going to be sitting more. So one natural way to prevent the aging back is to be more upright, to be standing, and to be walking more. And like I mentioned, the vicious circle is when we start to encounter pain and we want to sit because the pain is more involved when we stand or walk. That's where we come in to try to help you alleviate that aging back process. So to answer your question, like I mentioned before, walking I think is the key, mobility.
And how can we prevent falls as we get older?
So when we're not mobile enough and we're sitting, we tend to lose our ability to balance and to be able to, move about rooms and facilities and areas. So one key aspect of that is there's very specific type of physical therapy that can be started called vestibular therapy and balance training therapy, which we prescribe here. It incorporates balance areas of the inner ear along with strengthening of the lower extremities and the back. A lot of seniors are unaware that there's a very specific type of physical therapy offered just for balance and fall prevention. So I think that it's important to know that that's out there for you. And it's not a very easy fix overnight, but I think it's been very helpful in helping patients prevent falls. Because as we age, as you know, a fall could be very detrimental in fracturing a hip. Our bones tend to become a little bit more brittle as we age. So fall prevention is very imperative. Our practice tends to look at activities of daily living and how we can get our patients to be safer at home. For instance, I had a patient earlier this morning who is going to require more grab bars and areas where they can support themselves standing when they transition in the kitchen or using the bathroom. So we take a close look at that, and we get our occupational therapists and our physical therapists to sometimes come to the home or the living setting and help our patients with safety and support structures. But I think it's a combination of really just getting an overall picture of balance, strengthening, and safety features in the home.
And what are the most common reasons for issues or pain within the back or spine?
So arthritis as we age in the back is inevitable. It's going to happen. One of the key conditions that, as I mentioned before, that we will encounter is the spinal stenosis syndrome, where we tend to, from arthritis and the effects of aging, we get a narrowing in the spinal column. So when we look at the spine, the spinal cord travels down through the vertebral column, and our vertebral column is kind of like our load-bearing structure or our pillar that holds up our house, if you will. And over time, the column can narrow or become stenotic. So narrowing and stenosis are synonymous. And as that narrowing occurs, we tend to get pain. We tend to get the sort of the reluctance to stand or walk and the preference to sit more. So as I mentioned, that's a very common condition that we will all encounter when we age. It's called lumbar spinal stenosis. Yeah. So I just wanted to mention that in collaboration with the Solana Doylestown, we want to promote healthy living and exceptional senior living care. And in Warrington, PA, the Solana offers exceptional multi-dimensional facilities, not only in physical care, but also cognitive and mental health care and dementia care. And it's an excellent facility that has luxury living, and it'll allow you to live your senior years to your best and your fullest. So we wanted to thank them for contributing and supporting our talk today on healthy living and aging, and definitely check them out online, the Solana in Doylestown. So I thank you for tuning in today. I appreciate your time. And if there's any further questions, or if you'd like to come into our office for an appointment, our website is PENN, PENN, pain, PAIN.com. Please feel free to look us up, and we'd love to meet you.